What do DEXA scan T-scores mean for fracture risk? Imagine a quick, painless X-ray that tells you how strong your bones are. That's what a DEXA scan does. It measures bone mineral density, which helps us understand how likely your bones are to break. The results come as T-scores, which compare your bone density to that of a healthy young adult. Think of it as a score that shows how much your bones differ from the ideal young bone. The T-score is expressed in standard deviations, or EST, from that young adult average. A T-score above -1 means your bones are pretty strong, and your risk of fracture is low. When your T-score drops between -1 and -2.5, it indicates lower bone density, called osteopenia. This means your bones are weaker than normal but not yet classified as osteoporosis. At this stage, your fracture risk is higher than normal but not as high as with more severe bone loss. When the T-score is -2.5 or lower, it confirms osteoporosis. This indicates a high risk of fractures, especially in the hips, spine, and wrists. But it's important to remember that T-scores aren't the whole story. They measure bone density but don't tell us everything about your bone's strength. Factors like bone quality, previous fractures, age, sex, and other health conditions also influence fracture risk. For example, many fractures happen in people with osteopenia, not just osteoporosis. That's why healthcare providers often use additional tools, like the FRAX assessment, which considers clinical risk factors along with bone density, to estimate your chances of breaking a bone over the next 10 years. T-scores are most reliable for postmenopausal women and older men who haven't yet started treatment. In younger people, premenopausal women, or those already on osteoporosis medication, T-scores are less predictive on their own. So, a low T-score suggests a higher fracture risk, which might lead your doctor to recommend treatment. But they will also look at your overall health, history, and other risk factors to make the best decision for you. In summary, a DEXA scan T-score gives a snapshot of your bone density compared to a young healthy adult. It's a useful tool for diagnosing osteoporosis and assessing fracture risk, especially in older adults and postmenopausal women. However, it's just one piece of the puzzle. Your healthcare provider will consider your entire health picture and risk factors to help you stay strong and prevent fractures. Always talk to your doctor for personalized advice and guidance tailored to your unique health needs.